In this video by deck plate we will be discussing types of diabetes mellitus, some of the most common types of diabetes mellitus experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Different types of diabetes mellitus impacting military veterans. Diabetes is a condition that happens when your blood sugar, glucose, is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly. Diabetes mellitus is a condition that runs rampant among the veteran population. Of those particularly affected is the Vietnam-era community. As these veterans approach the years of wisdom, diabetes has a tendency to creep up alongside them. Following are some conditions that every veteran must know. Type 1 diabetes. This type is an autoimmune disease in which your immune system attacks and destroys insulin-producing cells in your pancreas for unknown reasons. Up to 10% of people who have diabetes have type 1. It's usually diagnosed in children and young adults, but it can develop at any age. Causes of type 1 diabetes. The exact cause of type 1 diabetes is unknown. Usually, the body's own immune system, which normally fights harmful bacteria and viruses, destroys the insulin-producing islet cells in the pancreas. Other possible causes include genetics, exposure to viruses and other environmental factors. Long-term effects of type 1 diabetes. Over time, type 1 diabetes complications can affect major organs in the body. These organs include the heart, blood vessels, nerves, eyes, and kidneys. Having a normal blood sugar level can lower the risk of many complications. Diabetes complications can lead to disabilities or even threaten your life. Heart and blood vessel disease. Diabetes increases the risk of some problems with the heart and blood vessels. These include coronary artery disease with chest pain, angina, heart attack, stroke, narrowing of the arteries, atherosclerosis, and high blood pressure. Nerve damage, neuropathy. Too much sugar in the blood can injure the walls of the tiny blood vessels, capillaries, that feed the nerves. This is especially true in the legs. This can cause tingling, numbness, burning, or pain. This usually begins at the tips of the toes or fingers and spreads upward. Poorly controlled blood sugar could cause you to lose all sense of feeling in the affected limbs over time. Damage to the nerves that affect the digestive system can cause problems with nausea, vomiting, diarrhea, or constipation. For men, erectile dysfunction may be an issue. Kidney damage, nephropathy. The kidneys have millions of tiny blood vessels that keep waste from entering the blood. Diabetes can damage this system. Severe damage can lead to kidney failure or end-stage kidney disease that can't be reversed. End-stage kidney disease needs to be treated with mechanical filtering of the kidneys, dialysis, or a kidney transplant. Eye damage. Diabetes can damage the blood vessels in the retina, part of the eye that senses light. Diabetic retinopathy. This could cause blindness. Diabetes also increases the risk of other serious vision conditions, such as cataracts and glaucoma. Foot damage, nerve damage in the feet or poor blood flow to the feet, increases the risk of some foot complications. Left untreated, cuts and blisters can become serious infections. These infections may need to be treated with toe, foot, or leg removal, amputation. Skin and mouth conditions. Diabetes may leave you more prone to infections of the skin and mouth. These include bacterial and fungal infections. Gum disease and dry mouth also are more likely. Pregnancy complications. High blood sugar levels can be dangerous for both the parent and the baby. The risk of miscarriage, stillbirth, and birth defects increases when diabetes isn't well controlled. For the parent, diabetes increases the risk of diabetic ketoacidosis, diabetic eye problems, retinopathy, pregnancy-induced high blood pressure, and preeclampsia. Diagnosis of type 1 diabetes. Diagnostic tests include glycated hemoglobin, A1C test. This blood test shows your average blood sugar level for the past 2 to 3 months. It measures the amount of blood sugar attached to the oxygen-carrying protein in red blood cells, hemoglobin. The higher the blood sugar levels, the more hemoglobin you'll have with sugar attached. An A1C level of 6.5% or higher on 2 separate tests means you have diabetes. If the A1C test isn't available, or if you have certain conditions that can make the A1C test inaccurate, such as pregnancy or an uncommon form of hemoglobin variant, your provider may use these tests. Random blood sugar test. A blood sample will be taken at a random time and may be confirmed by additional tests. Blood sugar values are expressed in milligrams per deciliter or millimoles per liter. No matter when you last ate, a random blood sugar level of 200 milligrams per deciliter or higher suggests diabetes. Fasting blood sugar test. A blood sample will be taken after you don't eat, fast, overnight. A fasting blood sugar level less than 100 milligrams per deciliter is healthy. A fasting blood sugar level from 100 to 125 milligrams per deciliter is considered prediabetes. If it's 126 milligrams per deciliter or higher on 2 separate tests, you have diabetes. If you're diagnosed with diabetes, your provider may also run blood tests. These will check for autoantibodies that are common in type 1 diabetes. The tests help your provider decide between type 1 and type 2 diabetes when the diagnosis isn't certain. The presence of ketones, byproducts from the breakdown of fat, in your urine also suggests type 1 diabetes rather than type 2. Type 2 diabetes. With this type, your body doesn't make enough insulin or your body's cells don't respond normally to the insulin resistance. This is the most common type of diabetes. It mainly affects adults, but children can have it as well. Causes of type 2 diabetes. Type 2 diabetes is mainly the result of 2 problems. Cells in muscle, fat and the liver become resistant to insulin as a result. The cells don't take in enough sugar. The pancreas can't make enough insulin to keep blood sugar levels within a healthy range. Exactly why this happens is not known. Being overweight and inactive are key contributing factors. Long-term effects of type 2 diabetes. Type 2 diabetes affects many major organs, including the heart, blood vessels, nerves, eyes, and kidneys. Also, factors that increase the risk of diabetes are risk factors for other serious diseases. Managing diabetes and controlling blood sugar can lower the risk for these complications and other medical conditions, including heart and blood vessel disease. Diabetes is associated with an increased risk of heart disease, stroke, high blood pressure and narrowing of blood vessels, a condition called atherosclerosis. Nerve damage in limbs, this condition is called neuropathy. High blood sugar, over time can damage or destroy nerves. That may result in tingling, numbness, burning, pain or eventual loss of feeling that usually begins at the tips of the toes or fingers and gradually spreads upward. Other nerve damage. Damage to nerves of the heart can contribute to irregular heart rhythms. Nerve damage in the digestive system can cause problems with nausea, vomiting, diarrhea, or constipation. Nerve damage also may cause erectile dysfunction. Kidney disease. Diabetes may lead to chronic kidney disease or end-stage kidney disease that can't be reversed. That may require dialysis or a kidney transplant. Eye damage. Diabetes increases the risk of serious eye diseases, such as cataracts and glaucoma, and may damage the blood vessels of the retina, potentially leading to blindness. Skin conditions. Diabetes may raise the risk of some skin problems, including bacterial and fungal infections. Slow healing, left untreated, cuts and blisters can become serious infections, which may heal poorly. Severe damage might require toe, foot, or leg amputation. Hearing impairment. Hearing problems are more common in people with diabetes. Sleep apnea. Obstructive sleep apnea is common in people living with type 2 diabetes. Obesity may be the main contributing factor to both conditions. Dementia. Type 2 diabetes seems to increase the risk of Alzheimer's disease and other disorders that cause dementia. Poor control of blood sugar is linked to a more rapid decline in memory and other thinking skills. Diagnosis of type 2 diabetes. Type 2 diabetes is usually diagnosed using the glycated hemoglobin, A1C, test. This blood test indicates your average blood sugar level for the past 2 to 3 months. Results are interpreted as follows. Below 5.7% is normal. 5.7% to 6.4% is diagnosed as prediabetes. 6.5% or higher on 2 separate tests indicates diabetes. If the A1C test isn't available, or if you have certain conditions that interfere with an A1C test, your healthcare provider may use the following tests to diagnose diabetes. Random blood sugar test. Blood sugar values are expressed in milligrams of sugar per deciliter or millimoles of sugar per liter of blood. Regardless of when you last ate, a level of 200 milligrams per deciliter or higher suggests diabetes, especially if you also have symptoms of diabetes, such as frequent urination and extreme thirst. Fasting blood sugar test. A blood sample is taken after you haven't eaten overnight. Results are interpreted as follows. Less than 100 milligrams per deciliter is considered healthy. 100 to 125 milligrams per deciliter is diagnosed as prediabetes. 126 milligrams per deciliter or higher on 2 separate tests is diagnosed as diabetes. Oral glucose tolerance test. This test is less commonly used than the others, except during pregnancy. You'll need to not eat for a certain amount of time and then drink a sugary liquid at your healthcare provider's office. Blood sugar levels then are tested periodically for 2 hours. Results are interpreted as follows. Less than 140 milligrams per deciliter after 2 hours is considered healthy. 140 to 199 milligrams per deciliter is diagnosed as prediabetes. 200 milligrams per deciliter or higher after 2 hours suggests diabetes. Screening. The American Diabetes Association recommends routine screening with diagnostic tests for type 2 diabetes in all adults age 35 or older and in the following groups. People younger than 35 who are overweight or obese and have one or more risk factors associated with diabetes. Women who have had gestational diabetes. People who have been diagnosed with prediabetes. Children who are overweight or obese and who have a family history of type 2 diabetes or other risk factors. Ketoacidosis. It is a metabolic state associated with pathologically high serum and urine concentrations of ketone bodies. Clinically relevant forms of ketoacidosis include diabetic ketoacidosis, DKA, alcoholic ketoacidosis, AKA, and starvation ketoacidosis. DKA is a potentially life-threatening complication of uncontrolled diabetes. It typically occurs in the setting of hyperglycemia and insulin deficiency, which causes unopposed lipolysis and oxidation of free fatty acids and thereby results in ketone body production and a subsequent increased anion gap metabolic acidosis. Causes of ketoacidosis. Sugar is a main source of energy for the cells that make up muscles and other tissues. Insulin helps sugar enter the cells in the body. Without enough insulin, the body can't use sugar to make the energy it needs. This causes the release of hormones that break down fat for the body to use as fuel. This also produces acids known as ketones. Ketones build up in the blood and eventually spill over into the urine. Diabetic ketoacidosis usually happens after an illness, an infection or other illness can cause the body to make higher levels of certain hormones, such as adrenaline or cortisol. These hormones work against the effects of insulin and sometimes cause diabetic ketoacidosis. Pneumonia and urinary tract infections are common illnesses that can lead to diabetic ketoacidosis. A problem with insulin therapy, missed insulin treatments can leave too little insulin in the body. Not enough insulin therapy or an insulin pump that doesn't work right also can leave too little insulin in the body. Any of these problems can lead to diabetic ketoacidosis. Other things that can lead to diabetic ketoacidosis include physical or emotional trauma, heart attack or stroke, pancreatitis, pregnancy, alcohol or drug misuse, particularly cocaine, certain medicines, such as corticosteroids and some diuretics. Long-term effects of ketoacidosis. Diabetic ketoacidosis is treated with fluids, electrolytes, such as sodium, potassium and chloride, and insulin. Perhaps surprisingly, the most common complications of diabetic ketoacidosis are related to this life-saving treatment. Possible complications of the treatments. Treatment complications include low blood sugar, also known as hypoglycemia, Insulin allows sugar to enter cells. This causes the blood sugar level to drop. If the blood sugar level drops too quickly, the drop can lead to low blood sugar. Low potassium, also known as hypokalemia. The fluids and insulin used to treat diabetic ketoacidosis can cause the potassium level to drop too low. A low potassium level can affect the heart, muscles, and nerves. To avoid this, potassium and other minerals are usually given with fluid replacement as part of the treatment of diabetic ketoacidosis. Swelling in the brain, also known as cerebral edema. Adjusting the blood sugar level too quickly can cause the brain to swell. This appears to be more common in children, especially those with newly diagnosed diabetes. Untreated, diabetic ketoacidosis can lead to loss of consciousness and, eventually, death. Diagnosis of ketoacidosis. A physical exam and blood tests can help diagnose diabetic ketoacidosis. In some cases, other tests may be needed to help find what caused the diabetic ketoacidosis. Blood tests. Blood tests used in the diagnosis of diabetic ketoacidosis will measure blood sugar level. If there isn't enough insulin in the body to allow sugar to enter cells, the blood sugar level will rise. This is known as hyperglycemia. As the body breaks down fat and protein for energy, the blood sugar level will keep rising. Ketone level. When the body breaks down fat and protein for energy, acids known as ketones enter the bloodstream. Blood acidity. A too high blood ketone level will cause the blood to become acidic. This can change how organs throughout the body work. Other tests. Tests that can help find health problems that might have contributed to diabetic ketoacidosis and check for complications might include blood electrolyte tests, urinalysis, chest X-ray, a recording of the electrical activity of the heart, also known as an electrocardiogram. Thank you for watching our video. Please don't forget to subscribe and like our videos.